Ready to go, Ray? Okay.
The broadcast is now starting. All attendees are in listen-only mode.
Alcidion Group Limited investor update. I'm very excited to have this opportunity to speak with you about the business and where we are taking it. So thank you all for giving us your time. The presentation is in two parts. Part one, the shareholder update. You can see the agenda items there. We'll be covering part one in detail in this webinar. We also, though, have a part two, which has a great deal of additional information about the markets and our products. We will not be covering that content in today's webinar, but if there is sufficient interest, we'd be very pleased to run a webinar specifically on those topics. High-level overview on the business. We have just over 600 million shares on issue at a share price of 5.8 cents. That gives us a market capitalisation of around $35 million. The high-level ownership structure is shown there. In terms of cash on hand, we have around $5.8 million. Our revenues in financial year 16 was a tad over $4 million. And you can see that we have been heavily focused in R&D investment in the previous life of Alcidion Corporation, and our R&D investment now is sitting at well over $18 million. Just a note on the bottom, as part of the stock purchase agreement for the reverse takeover, we have two tranches of performance shares available to us in the future, $4 million worth of additional scrip if we can hit a revenue target of $10 million by February 2018, and a second $4 million tranche if we hit a revenue of $15 million by February 2019. I'd just like to cover off now on the board composition. We have three executive directors. My co-founding colleague, Professor Malcolm Pradhan. Malcolm is medically qualified and completed his PhD in medical informatics at Stanford University, and he's played leading roles on both the education and on the association side of health informatics in this nation. Nathan Buzzer has been an executive director with us now for just over 2 years. Again, Nathan is a proven performer in the Australian scene as a technology entrepreneur. Previously founded the Comtech Wireless business, and during those years won the Ernst & Young Entrepreneur of the Year award, scored in the BRW Fast 100 executives, and has achieved in his home state now of Western Australia a Lifetime Achievement Award. My background has been in technology. I had a long career in the public health services here in South Australia, and I finished there as the chairman and chief executive. And during my tenure, I chaired the Australian Health Ministers Advisory Council. Moving on to our three non-executive directors, the longest serving has been Mr. Nick Dignam. Nick joined us at the time that Blue Sky took a private equity investment into Alcidion Corporation, has qualifications in commerce, law and finance. He's presently the investment director of Blue Sky, and Blue Sky is now around $1.7 billion of funds under management. Most recently, we've had Mr. Brian Leedman join us. As you can see, Brian has extensive experience in the med tech space, has had significant ASX company experience. He's presently chairman of the Western Australian branch of Oz Biotech. And finally, we have Mr. Josh Puckridge, who has really come through onto the board via the reverse takeover transaction. Again, Josh has qualifications in commerce, and you can see he's had extensive executive director experience on ASX and other companies. I'd like to now play a short video to illustrate a little around where Alcidion has come from.
How safe are you in a hospital? Globally, in the Western world, healthcare services struggle to cope with a massive increase of patients. But patients also have more complex needs for treatment. This is driven by rapidly ageing populations and the prevalence of chronic diseases. Clinicians are deluged with data about patients from multiple systems and sources, and they lack the tools to cope. Did you know that your care is still managed and tracked with pen and paper? Even though technology has created new levels of diagnosis and treatment, it has also caused new levels of complexity and workload for clinical staff. Coupled with global health trends such as obesity, overwhelming healthcare systems, you have a perfect storm for errors. Patients receive the wrong treatment or don't receive treatment. Their test results are lost. In fact, 40% of hospital tests are never looked at. Medication can be wrongly administered, given to the wrong person, or the wrong medication is given. This is why there are 12,000 preventable deaths per year in Australia, 44,000 in the UK, and the numbers scale the same in other places around the world. The number of people harmed while in care is enormous. Founded by Ray Blight, a former chief executive of the South Australian Health Commission, and Malcolm Pradhan, a Stanford PhD and former director of health informatics at the University of Adelaide. Their relentless drive to prevent harm has created the world's first real-time intelligent decision support system, purpose-built to meet the demands of global healthcare. Alcidion's technology platform Maya provides clinicians with the right tools by presenting the right information at the right time, making it easy for clinicians to manage larger and more complex caseloads. Alcidion is eliminating data deluge from clinical practice, and so clinicians can focus on patient care, thus reducing errors and harm. Used by leading healthcare services in Victoria, Northern Territory, Tasmania, Western Australia and New Zealand, with OEM partners Fujifilm and Vaportrail, Alcidion's healthcare technology is making care safer for patients and less stressful for clinicians. In the words of customers at Western Health Hospital, here's the benefits delivered.
It's been extremely beneficial from my point of view. We're able to see patient information more interactively. We're also able to pull up blood results, x-ray results on ward rounds and doctors' rounds without having to leave, so it's given us a little bit of time back. It's made things more transparent. We can certainly see the patient journey in front of us. It's made it more visual. The system assists in safe and effective patient care.
So that gives you an idea of the genesis of Alcidion, which has been in patient safety from day one, and we've transitioned through to focusing on care team performance. I'd describe our mission now as that of helping our customers achieve and sustain high-performance hospital services. By high performance, I mean services that are safer, faster, cost efficient, and produce clinically effective outcomes for the patient. So we're on about our customers delivering high performance hospital services by using our intelligent software to transform and improve not only patient care, not only staff productivity, but overall service performance. By intelligent software, we mean software that operates 24/7 in the background, continually processing patient data to build clinical intelligence that will help clinicians, nurses, physios, etc. make the best possible clinical decision for a patient as soon as possible. So our intelligence software is focused in the clinical decision support space. That is a key company differentiator. And the reason is because it's the clinical decision that drives many important factors in care delivery, such as the quality of the clinical outcomes, the levels of patient safety, the cost of services, and so on. In this slide, this is just making reference to our core asset, which is the Miya platform, and I'll come on and talk a little more about the platform. But this is the tool that takes data in from any source in a hospital. A common source will be other information technology systems, but it would also include taking data directly from medical devices. And as we move forward into the future, that will increasingly be an important source of patient data. The platform is our key asset. It's decision support focused. We've invested over $18 million in the development of the platform, and all of our applications sit on top of this, Miya platform. It is mature in the sense that the platform is now deployed in a number of public health systems across the nation. So what does the platform do? Well, the key to understanding the platform is its ability to build intelligence from the data and then present that intelligence to the care team in the context of clinical decisions that they need to make about that patient's care options. So we use the term e-health guidance because we're using smart clinical protocols to shape the intelligence and then to structure the way that intelligence is pushed to the care team. So you can imagine on a mobile device, as we've illustrated in this slide, a care professional is immediately appraised of a patient's clinical risk, and then in accordance with approved hospital guidelines is given guidance on what are likely to be the best treatment options for that patient. I'd like to now move on to the highlights for financial year 16. As at 30th of June, we held a bit over $5.6 million in cash, but a large invoice issued in June was paid in July, which took our cash at that stage, 31st of July, up to $6.5 million. The cash at the completion of the reverse takeover of Narracuda was a bit over $6.7 million. During FY16, we continued our R&D efforts with a bit over $2.2 million spent on R&D, primarily focused on our new smart orders product, a computerized physician order entry product, which is now in a paid beta test situation with our NT Health customer. But also during FY16, we brought other new products, My Clinic and My Referrals, to beta level status. So it's a very active year in terms of R&D and in terms of new product capability. The company has been a participant in the Commonwealth R&D Tax Incentive Program, and that provides a 45% cash rebate for qualified R&D expenditure. Our focus is on the Australian and New Zealand healthcare market, not only through a direct approach, but also through strategic partnerships. And one example of a strategic partnership would be the one we have with Fujifilm Australia, where we have used the Maya platform to build an intelligent cardiovascular information system for that business, and they are out selling that under their brand name to the Australian New Zealand hospital networks. Another significant highlight was the execution of a $2.35 million MOU with Western Health. That is a public hospital network in the western suburbs of Melbourne, includes 3 public hospitals, has a catchment population of close to 1 million people. And the significance behind that MOU is that they have now taken products that started out as pilots in their organisation, have now flowed through into production implementations. Another highlight for me was the appointment of Mr. Brian Leedman to the board. He's brought extensive ASX and medtech expertise to the business, and in the short time that he's been on the board has already made a significant contribution. During FY16, we made conscious decision to realign our resources towards increased sales and marketing capacity and effectiveness. And as we go forward, that will continue to be our focus. We will still continue R&D, of course, but not at the levels of previous years, and not at the expense of sales and marketing. In terms of our technology, we have seen the opportunity to phase out some internally developed codes and tool sets. As the informatics market has matured, new industry standard tools have come on stream, and we are leveraging those for a number of reasons. First of all, to reduce the cost of delivery of our products, but also to reduce the training requirements of our staff. By using industry standard tools, it's much easier to recruit staff with those capabilities. I previously mentioned the smart order entry product. We are very focused on the North American marketplace. It remains our ambition over the next 3 years to achieve sales success and a physical presence in the North American market. In terms of how we do that, we are currently looking at an entry via the Canadian marketplace, and we have non-binding discussions along those lines in place. Our partnership with Fujifilm, we are very optimistic about. Fujifilm has approximately a 70% share of the cardiovascular radiology market, so that should augur well for sales going forward of the ICVIS solution. A quick update on the reverse takeover. This was a very time-efficient transaction. From start to finish, it was just a little over 6 months. The transaction concluded with our listing late February. Can't get much later in February than the 29th. And you can see there 600 million plus shares on issue. We took over Narracuda Resources Limited, a mining exploration shell. There were significant one-off costs associated with the transaction. There was a one-off non-cash expense of 1.1 million associated with the carry-forward losses and expenses of Narracuda. And then on top of that, we incurred another set of expenses around the 600,000 mark. So very time efficient, but it did come with significant expenses. This next slide gives you an idea of why we are very optimistic about the growth of the clinical decision support market. The independent industry analysts are predicting a quadrupling of this market over the years to 2018. A lot of that is going to be driven from customer demand, which is, really around the unsustainably high cost of hospital services, the unacceptably high levels of errors and, so I should say, preventable errors in delivering services. But it is also being, driven by other factors, demographics and economics factors, ageing populations, increasing prevalence of chronic disease, increasing comorbidities amongst our ageing population, and so on. But other drivers are coming from the technology itself, and I think Alcidion is a classic example of this. We are now able to deliver very cost effectively tool sets to really drive patient safety, to really drive care team productivity that were not even imaginable 2 to 5 years ago. But there are concerns with the massive growth in medical know-how, in the medical knowledge bases. There is a real issue with how care teams can keep abreast of current best practice, how they can avoid being pinged with alerts from a whole range of medical devices and other IT systems. And again, that illustrates the sweet spot for Alcidion, where we are able to manage those challenges on behalf of the care team. Just a quick review about strategic directions going forward. I've covered most of these, but just to recap, focus has been transitioning from a private company to ASX listed with a modest capital raise. That's been done. We're working now on maturing a number of key paid beta site installations into commercial deployments. The Smart Orders projects in NT Health would be an example. The new clinic project in Tasmania would be another example. We've already made good progress on improving the speed at which we can deploy our products. And we have already put very extensive effort into our marketing and promotional materials. In FY16-17, we have started to shift the focus from engineering to significant sales and marketing capability. We've made real progress on that this year, but that will continue to be a focus in FY16-17. Accelerating revenue is our number one business priority. That will be via my platform sales across Australia and New Zealand. They won't always reflect as my platform sales. They will reflect more likely as my flow sales, bed access product sales, and ICVIA sales. We've got more work to do in FY17 around commercialising our SmartForms platform. So SmartForms is a new technology to dramatically improve the speed and accuracy of clinical documentation. That is presently a major time burden on care teams in hospitals. And we are looking at delivering SmartForms via a cloud-based offering to help us accelerate our commercialisation. We will be looking to forge further strategic partnerships, and we are setting ourselves the goal of securing a North American pilot by the end of FY17. Along the way, we will be working very hard to build brand awareness in the North American market, but our goal will be to also have a pilot. Moving on to FY18, we want to achieve a significant Australia-New Zealand base, but really the focus is very much on accelerating the US North American business. That will require us to have completed the QSR 820 quality manufacturing standards to achieve FDA compliance. But by January 2018, we want to have a physical presence in the US. I'll just finish my overview with two quotes. This one is from Nick Dignam, and just explains why, and how Blue Sky took private equity investment in Alcidion. And then the final quote is from Nathan, and explains why Nathan has become not only an executive director, but also an investor in Alcidion. So look, without further ado, I'll now hand over to Nathan to take us through the investor relations update. Over to you, Nathan.
Thank you, Ray, and what a great overview. So before we go into the investor relations update, I just thought I'd take a few moments to describe why I'm really excited about where Alcidion is in the marketplace and some of the motivations for my private equity firm, Allure Capital, to invest a considerable sum of money into the business. So Alcidion was born out of the former CEO of South Australian Health, and Ray was also the former CIO of South Australia Health, and became very frustrated with the poor adoption of information technology and the poor efficiency gains. So Ray then partnered with Professor Malcolm Badam. Malcolm's a medical qualified doctor and also holds a PhD in medical informatics from Stanford University. Now, when we're developing these platforms, they are extremely sophisticated, and a lot of work goes into correlate all the disparate clinical information systems. So I can just talk what that means for a moment. There's two schools of thought on how to deploy a clinical information system across the continuum of healthcare. So one school of thought is each department takes the best of breed solution. So the head of pathology, for example, will evaluate all the laboratory information systems available on the market. He'll key out what features he wants, and then he'll choose that best one. Similarly, the head of the cardiovascular department will look for a cardiovascular information system and choose the best product that he wants, and that process is repeated over each of the departments within the hospital. So that approach is called a best of breed. Each department buys the best product most suitable for the rollout of their platform. Another approach is what we describe as the monolithic healthcare approach. This is when a very large healthcare company says, you know what, you've got all these disparate systems, we're going to pull all of those disparate systems out and replace them with our one system. So Alcidion's strategic advantage is the market approach means it doesn't go out to displace all of the current clinical information systems. It's a supervisory system that sits on top of all of those systems. So take the data feed in from the pathology platform, a data feed in from the cardiovascular platform, from the emergency department platform, from the patient admission platform, and that list goes on. There's some very key advantages over this approach. So key advantage is obviously cost. So if we're looking at, say, a deployment, a good example recently is Allscripts secured a $400 million contract to deploy their platform across the continuum of hospitals in South Australia. If we're looking at a deployment for an individual site, you're probably looking of the order of between $10 and $40 million to deploy one of these large, high-end platforms. Alcidion can keep all of those existing platforms on the site, all the best-of-breed products that have been chosen by the heads of the department to maximise the use of the platforms. But medicine is a holistic science. If we have a pathology result coming in, so for example, if troponins come back as being elevated, then we know from the blood test that we now want to look at the imaging result to see, well, what is the extent of damage to the heart muscle. So then we'll look at a chest X-ray or MRI. So the cost base is one really outstanding feature. Being able to maintain the best of breed solution installed is another key advantage. When you buy a single source vendor and displace all those platforms, you lose that best of breed functionality, which causes the individual department heads to become frustrated. And of course you've got the costs and the risks associated with that. We only need to look at the popular press on the deployment of these monolithic platforms, where when you basically press Control-Alt-Delete on a whole wide installation of clinical information systems, it doesn't go very smoothly. So there's a high risk and a high cost of management associated. So on that basis, when I looked at what Alcidion had created, and it has world-class user interface. Many of these monolithic providers have built their companies through a sequence of disconnected acquisitions. So whilst they come to market as one vendor, they look very dated and they don't actually have the high levels of interoperability that is being perceived by the marketplace. If you look at the quality, and this is a very consistent theme, as we present to the continuum of hospitals across Australia and New Zealand, we always get compliments on how quickly the platform functions and what a pleasure of the platform is to use. We did a presentation recently to a major hospital. I'm not at liberty to discuss which hospital that was, but the bad manager immediately just grabbed the iPad and with zero training was using the platform straight away. Yeah, and this is born out of Malcolm's experience working in the healthcare environment and Ray's experience where they'll be facing IT systems which have 30-second latencies from when you're trying to action things. So this is a really exciting time to be joining the company. It's expensed $18 million worth of product development to create this absolutely outstanding technology in the Maya platform. It's now deployed at a very large selection of beta sites. There's Western Health, Northern Territory, Tasmania, Royal Melbourne Hospital in the ED department. It takes time, to deploy the technology, because hospitals are very conservative, but now that we've demonstrated the technology works, and this is really the significance with the Western Health Memorandum of Understanding. Aside from the financial impact on it, on the deployment of that site, the most exciting part for me is that demonstrates that our product has transitioned from being a beta installation as a concept to a real commercial deployment in the eyes of the customer. So that's the green light for Alcidion to now go forth and promote and sell the products to the continuum of hospitals in Australia and New Zealand. So moving on to that, I just want to cover a few of the investor relations. So as I'm sure the shareholders are aware, Alcidion was listed on the ASX through the reverse takeover of Narracuda Resources. So really that gave us blocks of shareholders. We have the original Alcidion Corporation shareholders who hold 400 million shares. The original Narracuda shareholders hold 138 million shares. And then there was 64 million shares that are issued associated with the $2 million capital raise. Then there's two other segments of shareholders. We've got one group, which would be the group attending today's webinar, where they've invested into the medical informatics business. And of course, there's a sequence of day traders. Next slide, please. So I just thought I'd give a breakdown on those blocks of shareholders. So since the company listed, if we have a look at the 400 million shares that were issued to the original Alcidion shareholders, not one share has been disposed of through that group of shareholders, and all of those shareholders do have tradable stock. A portion of those shares are escrowed for either 1 year or 2 years. Out of the 64 million shares that were issued at 3.1 cents, and Patterson's led the capital raise on behalf of Narracuda, out of the 64 million shares, 54 million of those shares have now been divested. So our hypothesis is that they listed at 3.1, the share price, I think we listed at 5.6 cents on listing, and the investors from the prospectus have now primarily divested it. And of the Narracuda shareholders, looking at comparison which predated the announcement listing on the ASX compared to last week, about 50% of those shareholders have divested and about 50% have maintained their holding. So I'm happy to answer any further clarification on that, but hopefully that clears down. I get a lot of questions from shareholders trying to understand where these blocks of shares are coming from. So if we just talk about the North American commercialization strategy for a moment. So both of my prior businesses, with my Comtech Wireless business and Azure Healthcare, where things really started to go well for us, and if I look at Azure, we went from 3.5 cents to 47 cents to over a 2.5 year time period, and revenues from 16 million to 34 million over that same time period. And that was really being driven out of the commercialization of the products in North America. And likewise, the business prior, Comtech Wireless, as Ray mentioned, that was being fueled out of growth of North America. So it's a segment I'm very, very passionate about and very excited about. There's some really exciting things going on, and Malcolm will be covering this in more detail when we get to his portion of the presentation. But principally, legislation has been passed through Congress in the United States that requires all 8,000 hospitals in the United States to make progress towards what is called the EMR adoption model. So you can think of that as the computerization and digitization of the disparate clinical information systems. As of last quarter, 95% of US hospitals had not reached an EMR adoption model level 7, so a fully automated platform. So we have a very clear market opportunity to get into the North American marketplace, and it'll probably be there for the better part of a decade. The punitive damages for hospitals that have not adopted or made progress towards digitising their platforms started on the 1st January this year. So that means if you're a North American hospital and you're not making progress to digitising, computerising your platforms, then the amount of Medicare and Medicaid reimbursements that you receive is actually gets progressively reduced. On the flip side, the US federal government is providing funding and incentives to do so. So very quickly, the short-term commercialisation strategy moving forward is our sales team is systematically moving through the continuum of hospitals in Australia and New Zealand. So this is a very recently actioned commercialisation strategy. It's 90 days old. And what this involves is healthcare ICT consultants. So these are the trusted advisors. So people like Deloitte and Ernst & Young who are advisors to healthcare organisations over ICT. We're actively engaging strategic partners and co-bidding on proposals with them to solve healthcare organisations' challenges. The actual hospitals themselves, there's 800 hospitals in Australia. We have sorted those from the largest hospitals to the smallest, and we've also sorted them from the worst performing NEAT targets, the National Emergency Access Target. So this is where people have to wait a very long time for service within the emergency department. And we're systematically going through arranging meetings and meeting and greeting each of those healthcare organisations, along with the district health boards and the local health boards, and also the private hospital groups. So we're targeting to be meeting 15 hospitals or hospital groups every month in a sequence of sales roadshows to raise the awareness of the Alcidion platform. Next slide, please. So there you go, that reiterates that. So we've got 8 health departments, 10 major healthcare consultancy firms, and 15 major strategic partners. The strategic partners we're looking for are companies who are actively involved in selling health ICT products into the continuum of health. Next slide, please. So with that, I'll hand it across to Malcolm Dunn to then talk about the case study for Western Health and some of the more exciting things that he's working on. Thank you, everyone.
Thank you, Nathan, and thanks everyone for joining the webinar. So I'll just go over what our product strategy is and look at some of the examples of our products in use. And as Nathan said, just flesh out a bit of our strategy in terms of the US and the US market. So Alcidion has always strived to create products that support high-performance healthcare, and what that means is that our products actually save time for busy clinicians rather than making their job harder, which is the common case in healthcare IT. So our products are designed to push important information to the clinicians and visually surface risk, so clinical staff don't have to remember to go and check information, spend time searching for it, and then even more effort interpreting what that information means. Because if we can save time for clinical staff, then they will engage in focusing on the important work, like making sure patients get the right treatments and they have the best outcomes. So the slides that you've seen are the kind of feedback we get excited about. In healthcare, it's well documented the vast majority of health IT systems today, including systems from big electronic medical record or EMR vendors, reduce clinical productivity and aren't popular to use. In contrast, we rely on our products to be adopted voluntarily by staff of all kinds. And that's why this quote from Jason at Western Health is important. As ICT manager at the time, he was surprised that staff were keen to use the Alcidion systems without being forced to do so, which is really the common change management strategy for other systems. Another important differentiator for Alcidion is our approach, in that we design systems to take full advantage of computerization rather than just trying to duplicate paper on the computer. And with the My platform, we gather data from multiple sources, identify risk, and then present task-specific views for clinicians to get their job done faster and improve safety.
Stroke patients and complex neurologically sick patients in 21st century is not easy. Our patients are complex and they would like to be involved throughout their patient journey these days. It's no longer the way that we used to manage patients 30, 40 years ago. So the current system has basically revolutionized the way that we manage these patients. So the whole team can look at the process of patient's journey from the day one, and with the interactive devices that we have by the bedside, we can get our patients involved. The more our patients get involved in their process of care, we can deliver what we want, which is to get our patients well and get them back home.
So the IPJS that we've created for Western Health is comprised of a number of features. We've got the large resolution big screen TVs that are mounted to the wall. We've also got a desktop portal that enables clinical staff to access the system on a desktop machine, and then there's mobility via mobile devices, and that enables clinical staff to access information and also input data into the system anywhere, and most importantly at the point of care at the patient bedside.
To provide safe and effective patient care, when we are managing these patients, we need to access their basic information and their day-to-day blood test results, their imaging results in a timely manner. The more accessibility of these things for the whole team, we can access all this information within the day-to-day working environment pretty much by the bedside. So this has basically skyrocketed the efficiency in patient care as well as the safety.
So the IPJS was rolled out here 6 months ago now, and we were the pilot project. It's been extremely beneficial from my point of view. We're able to see patient information more interactively. We're also able to pull up blood results, x-ray results on ward rounds and doctors' rounds without having to leave, so it's given us a little bit of time back. It's made things more transparent. We can certainly see the patient journey in front of us. It's made it more visual. The system assists in safe and effective patient care by identifying patients who are at risk. It makes it more visual, so anybody can come onto the ward and actually identify the patients who are at risk, whether that be for falls, whether that be for contact precautions, and it makes it very easy for staff and for doctors to identify risks on the ward.
What we have created is an e-health guidance system that actually enables clinical staff to deliver faster, safer and more effective care.
So healthcare is a complex industry, and Alcidion has experience and credibility in this space with products in major health systems working at volume. And healthcare is facing a set of unique challenges that can only be solved through innovation. The industry needs technologies that support delivering healthcare in new ways, and this presents significant opportunities for Alcidion. Healthcare is starting a period of unparalleled growth and change. So healthcare costs threaten to consume state budgets here in Australia, and costs will at least double over the next 35 years if we continue business as usual. For example, the US spends 18% of its GDP on health, and that's heading to 37%, and that's actually with quite poor performance. There are two main factors driving this increase. One is an aging population. So in 30 years' time, people aged 85 or older in Australia and other Western countries will increase by 4 times from levels of today. And that's important because that population has multiple chronic diseases that place huge burdens on healthcare systems. And if we continue to manage illness in the same way as today, the system will just fail. Another factor is the increasing cost of modern treatments, which require better decision support tools to ensure that patients are managed in the most cost-effective way. As a first step in improving healthcare in the United States, the government there legislated the Affordable Care Act, the ACA, or Obamacare. And this was to set up new insurance mechanisms, but another one of its goals, represented in the related HITECH Act, was to start healthcare reform by implementing electronic health records. And the idea was that these computerized systems must be meaningful to patient outcomes. In other words, they need to improve healthcare. And there is still large ongoing investment in the US to support meaningful use in healthcare IT systems. Now, it isn't obvious, but a huge problem in healthcare is the sheer logistic complexity of getting patients through the healthcare process on time and without errors. And along with patient safety aspects of the Maya platform, we also market a patient flow solution that assists in managing the coordination of patient care through the complex patient stay. And this is a growing segment. So it's worth noting about 1 in 5 patients in Australia staying in hospital for more than a day suffer preventable error. In the US, the 3rd largest cause of death in the country is preventable errors in healthcare. So the opportunities in health are big. The industry is under pressure with high costs, big investments, low efficiency, high error rates, and high visibility. And the barriers for entry for new companies are large because of regulation and complexity, and we believe Alcidion's Maya platform is really well placed to support the new models of care that are required to make healthcare sustainable. So digital health is a very broad area, from consumer-driven health right through to underlying technical standards. And Alcidion's Maya platform as a supervisory system can take information from systems right across the digital health landscape and provide a unified platform for clinical decision support and monitoring healthcare processes. And Alcidion is currently placed in the area of health information management with the rich integration of hospital data feeds that provide us with large volumes of clinical and operational data. And we believe that the Maya platform is a prime delivery mechanism for the high value elements of digital health that improve patient care and improve healthcare efficiency. Personally, I see the future of healthcare moving from being a kind of crisis and response driven model to an increasingly a data-driven and predictive approach. And Alcidion is well placed to lead in these areas because we have access to data and expertise in machine learning. So I'd like to discuss some of the drivers in healthcare investment in a bit more detail. The current state of play is that the US is leading digital healthcare adoption through a mixture of incentives and penalties. An example of this is, as Nathan mentioned, the EMR adoption or MRAM model that grades each hospital on how well it uses technology, and I'll cover that in the next slide. In the last 10 years, we've seen the rise of mobile technology. So today, the smartphone is really the personal healthcare hub for people, and people want to collect data and have that presented to them. So the drive from consumers to access their healthcare data so they can better manage their own health, along with government pressure, is driving increased interoperability of healthcare data. And in the past, this was a big problem because large healthcare vendors would not allow data out of their systems just for strategic purposes. But currently, with these other pressures, large vendors are now starting to support improved interoperability, making it much easier for the Maya platform to play a role of a supervisory system across major EMRs. And people, and as I said, healthcare has regulation bodies like the FDA in the US and others, which makes it hard for companies just to come in and try to innovate by avoiding regulation. And so I think companies with established products and good track records in healthcare are well poised to take advantage of the changing landscape in healthcare. The EMR adoption model developed by the HIMSS organisation is a way of tracking hospital use of digital technology for core services. And Alcidion has products that target key milestones in the MRAN model. So whether it be down at level 2 for clinical documentation support and control medical vocabularies and error checking through smart forms, for example, up to level 3 and 4 for CPOE or computerized physician order entry of lab orders and decision support, and up further up the chain for physician structured templates and full computerized decision support, and even stage 7 features such as emergency and ambulatory systems. So while some healthcare systems try to achieve stage 7 with a single large vendor, many run out of money before they can afford to do so, and they face really big change management problems which inhibit the use of these advanced features. So Alcidion provides a way for healthcare providers to select high return on investment features of the MRAM model with much lower cost of entry and much less change management overhead. So In the US, there's been significant incentives for hospitals to implement EMRs, and from the last year, there's been penalties to reduce reimbursements if hospitals don't adopt high levels of EMR use. And despite these carrots and sticks, the EMR adoption in the US has been pretty slow. Many hospitals have actually decided that it is more cost effective for them to accept reduced reimbursements rather than go through the expense and change management of adopting these large EMR solutions. So there's something seriously wrong in an industry where, when in healthcare when organisations refuse government money. So Alcidion sees this as an opportunity. We can provide lower cost and much easier to use systems that help healthcare organisations meet meaningful use standards. And it's not just about helping hospitals improve their reimbursements, while that's important. It's also about enabling better care and safer care for patients. And we believe that the My Platform enables healthcare to innovate in ways that existing large systems simply do not support. And we can enable them to respond to changes in healthcare demand, to try out new models of care, to start making use of advances in machine learning, and to do it in a way that makes it easier for busy clinicians to do their job and to support patients manage their health. So that's it from me. And I think we'll open it up to questions. Nathan, if you want to kind of help us through the questions.
Certainly, Malcolm. Thank you very much for the great overview. So, sequence of questions coming through. So, question number one, could you please provide an indication of the typical contract size? You mentioned the Northern Territory project in a press release. This is a relatively small hospital. Can you provide some guidance to the size of this project? Ray, would you mind addressing that question, please?
Yes, so contract size depends on product scope, but if we took a typical Miya Flow, Miya Bed Access solution, so that's the type of journey system that Malcolm has described, for a medium-sized hospital, probably looking at one-off upfront commissioning and installation costs of around $300,000, and from point of production commencement onwards, there is then a follow-on annuity. Again, that depends on the scope of the functionality, but I guess a typical estimate, would be, somewhere between $100,000 and $150,000, per annum. So if you look at 5-year total cost of ownership, for an average, Miya Flow, installation, you're probably looking around the, $750,000 to $1 million contract value. When we look at some of our other products, for example, the Intelligent Cardiovascular Information System, a contract is worth, to Alcidion, is probably worth around the $150,000 mark, one-off up front, and then an annuity of around, $30,000. Looking forward, as we commercialise products like smart forms on the cloud platform, we're looking to be able to, reduce the costs to the customer quite extensively. So we are seeing that those contract values will be of a smaller value, but we see that we'll be able to, implement them very rapidly and implement them very widely across healthcare, not only in the hospital space, but with smart forms, huge opportunities for out-of-hospital care, home care, and community care. Thanks, Nathan.
Thank you, Ray. Another question's come through. I saw in your presentation 96% of hospitals are yet to achieve a fully digital environment. Why is this the case? It seems unfathomable that in this day and age the hospitals are not fully automated. Ray, would you mind filling that?
Yes, thank you, Nathan. A large part of the answer is the very poor solutions that have been traditionally available via the large EHR vendors. So Malcolm touched on the issues with these large EHR vendor solutions. Let me just recap though. They are very expensive to purchase, but on top of that, they are extraordinarily expensive to implement in a change management sense. And that's because these systems, have evolved, over 10, 15 years. Often they're not able to provide modern technology. They assume, work practices, from 5, 10, 15 years ago. So they're not responsive to, modern and improved models of care. And also the quality of the user interface is really, really deplorable. So for example, a clinician, makes a decision for a patient, and then they'll go to the electronic health record, and they may have to click through half a dozen or more screens, typing a bit of data in here, a bit of data in there. And so that cumbersome human interface is really chewing up the productivity of the care team. So that's why we see with our technology, particularly, smart forms, but with a human interface that's highly visual, fast, and where a doc or nurse can really just tap in their clinical decision through half a dozen taps on a mobile device. We have got an offering now that can, turn around, that rather deplorable statistics of, very poor uptake of this technology. Thanks, Nathan.
Thank you, Ray. Another question, or a sequence of questions over finance. Do you capitalise or expense your R&D? What would have been the underlying profit if you have not listed the business and not spent money on R&D? What were the costs directly relating to the transaction? Ray, I might field that if I can.
Yes, go ahead.
So we reported, I won't be able to calculate the exact figures in real time, but we reported a loss of $2.525 million, but this includes a non-cash, non-tax loss of $1.1 million. Now that to when we did the reverse takeover of Narracuda Resources, there was a gap between the transaction price and the value being paid. So it's the $1.1 million is no cash out of the business whatsoever, and it would not have arisen if it wasn't for a reverse takeover. So much more of it's a valid, but it's an accounting entry, not a cash or tax entry. The company then spent approximately $600,000 in professional services fees between lawyers and accountants and professional advisors to get the business listed. We put that in context. An IPO, for example, would probably cost between $1 million and $1.2 million. So $600,000 was a saving versus doing the IPO. And the last part of the question, which relates to a capital raise, we're not anticipating raising any future capital over the next 3 years. We're expecting, with the strong balance sheet that we have in the company at the moment, coupled with the 45% cash rebate we get from the R&D tax incentive, more than provides runway for us to get across to the United States and commercialise the product suite. We're also asked, do we capitalise or expense R&D? We spent about $2.2 million in R&D in last financial year, and we expensed the entirety of that. So to work out what our underlying profit would be, I'd have to add them all back in, add back the R&D, add back the calculators. It can be calculated to go through the areas. Why? So another question coming through. Why does a hospital want to buy your products? Specifically, why do the decision makers choose Myer in particular? Is it better or cheaper? Can you please explain further?
So I guess the decision makers in the purchasing decision start most properly, with the clinicians, and why they want to use Alcidion's product is because it focuses on the thing that matters to them. That is, best understanding what the patient's clinical risk is, being given guidance in real time on what the best practice clinical choices might be for that risk, and then being able to quickly and effectively record their decision and know that the Alcidion solution will then, publish that decision to all steps in the follow-on care process. The clinicians, though, are generally not the purse holders. So I guess the next level of decision making is at the level of the hospital executive. And at that level, the focus is really around resource utilisation, cost management, and so on. We are attractive to the hospital executives as purchasers on a number of fronts. By better managing patient safety, we reduce and help eliminate the very high cost of litigation. But probably as importantly, we're able to, through the flow system, for example, give hospital executives a real-time view of how the hospital's bed stock and other resources are being, deployed. And through that, we're able to, again, in real time, help them see that they are meeting the key performance indicators, like patient length of stay targets, like transit time through emergency department targets, that they are being held accountable by the state health departments and the Commonwealth and other funding bodies. So we've got that two-pronged value proposition to the clinicians and care teams who do the real work in hospitals, high value add to them. But then on top of that, for the final purse string holders, we've got business performance value add for them. Thank you.
Thank you, Greg. We have another question which has come through. I'd like to know the thoughts of management regarding the 54 million shares divested from the 64 million shares issued in the prospectus, and why have so many sold? So I'll take that question if I may. So Narracuda Resources was listed through an IPO, which was led by Patterson's out of Perth. I suppose by definition, with an RTO, the original listing company, Narracuda Resources, had failed, and then Patterson's then raised the $2 million on behalf of Narracuda Resources. So this is immediately predates Alcidion's involvement. The capital raise was done at 3.1 cents, which represented the cash backing and a small premium for the shell. Immediately after the announcement of the transaction, the share price of Narracuda Resources jumped up. So our hypothesis is that the people involved, or the shareholders involved in the 3.1 cent capital raise under the prospectus, just elected to realise their gain and move on to their next transaction. It's difficult for us to hypothesis on individual shareholders, but if they invested 3.1 cents and the stock is trading at 5.6 cents, within the matter of a few weeks, I think they've just moved on. I hope that answers the question for you. Who are Alcidion's competitors? And do you have an assessment of competitor market share in Australia and New Zealand and the United States? Ray, would you like to field that?
Well, I guess I'd characterise our competition as big and ugly. By big, I mean it's really the large, well-established health IT vendors who have established, their respective market shares. But I describe them as ugly because the return on investment in those systems is extremely poor. And that was borne out by the US Senate reports back in 2014, where after $30-odd billion worth of funding support to the large EHR vendors, dissatisfaction from doctors was very high. Very large proportions of physicians would not use the systems because they felt it didn't help them, with their work, and it slowed them down. So I think as a new entrant into this decision support space, I think we have got now an extremely competitive product, which is what the market actually needs. And they really haven't had that choice before. Up until now, it's been, well, you choose between one big EHR provider or another. So our challenge is really, rapid market entry for our product. And we are looking, as I mentioned before, not only at direct sales, but we are looking for strategic partnerships. So we will actively explore partnerships with one or more of the big ugly guys in the interest of making them famous and getting our technology out through their channels to market.
Ray, we have another question which has come through, which might be somewhat difficult for us to respond to in light of our disclosure requirements, but they're asking for an update for the project we're working on for the New Zealand hospitals. Is there any status/progress update with the New Zealand hospitals?
I'm sorry, Nathan. I inadvertently went to mute. Yes. So with regard to the New Zealand market, we have announced that we have achieved preferred vendor status for a significant project with one of the New Zealand district health boards. There are some 20-odd district health boards in New Zealand. We're not able to make any further announcements about that project at this point in time. But I can say that I'm very optimistic about the New Zealand market. The public sector there is structured quite differently to the Australian public health sector. They are able to make decisions much faster. They are hungry for innovation. They show very significant propensity to be early adopters of new models of care and supporting technologies. So I can see us maintaining a very strong focus on the New Zealand market. And as we achieve success there, of course, it will be appropriately announced by the ASX.
Thank you, Ray. We have another question asking, what is the state of play with the rollout of the EMR adoption model in Australia? And what funding has been allocated towards that? I might field that if I may, Ray. So there's been some quite exciting progress over recent months. Many of the health departments in Australia have formed new healthcare or e-health organisations. We saw, from memory, in October of last year, so this is how recent things are. So October last year, the Queensland government formed eHealth Queensland, and they just had their inaugural eHealth Queensland conference just 2 months ago. So they've allocated $1.3 billion to renew all of the IT platforms within Queensland Health, and that comprised of $780 million to upgrade their clinical information systems. And there has been a multitude of tenders that have come out recently, some of which we are responding to directly, some of which we're responding to indirectly to secure some of that. We've seen the Northern Territory Health Department have had $186 million of funding approved to upgrade their core clinical systems. And obviously Northern Territory Health are a very significant customer for us. We've also seen in New Zealand the National Health IT Board is being replaced, I think, just next month with a new digital health agency. And in Australia, we're seeing the formation of a NEAT is being replaced with a digital health agency as well. So in the past 12 months, there has been a huge volume of focus from the Australian and New Zealand governments, and in fact the governments of the world, recognising health IT and the requirement to upgrade to the state-of-the-art technologies. So hopefully that responds to that question. We are running over time at the moment, so I might hold the questions there. But thank you very much for all the questions. Any of the questions which have come through, which we have not had time to respond to, if they're not market sensitive questions, I'll respond to them directly. If they are market sensitive, then I will ensure that we address them in the annual report. So thank you everyone for their time, and Ray, just back to you for any closing comments.
Thank you, Nathan. No, nothing further for me to add, other than to thank everyone for giving us the time to give you this investor update and tell you a little bit about the company and its business. Thank you, everyone, and good day.